Okay, imagine this. You're watching your dog, right? Your best friend, maybe they're running around the yard chasing a ball full of life.
Yeah.
And then you see it. A little hitch in their step, maybe favoring one leg. That limp that just wasn't there yesterday.
It's instantly worrying for any owner.
Totally. It's frustrating. You don't know what's wrong. And, well, if you love a dog, it just pulls at your heartstrings.
Absolutely.
And when that lameness seems to be coming from up high, the front leg near the shoulder, well, that can be a particularly tricky puzzle.
It really can. The shoulder in a dog, it's a complex area hidden under a lot of muscle.
Right.
So figuring out exactly where the pain or the problem is, well, it's not always straightforward.
And that's exactly what we're digging into today. We've got a whole load of clinical information here, veterinary guides, all focused on canine shoulder lameness.
Good stuff.
And our mission really is to pull out the key information, the aha moments, the core understanding. You need to get a clearer picture of this whole complex issue.
We're going to try and navigate through these details using the info straight from these guides to help you understand what's actually going on under the surface.
We want to give you those critical insights that vets use.
Yeah.
Highlighting why it's sometimes so challenging and, importantly, how they actually figure it out.
Right. The diagnostic process.
Okay, so let's start right at the beginning. When we talk about canine shoulder lameness, what are we actually talking about? What does that really mean?
Well, simply put, it just means there's some kind of dysfunction or pain, either in the shoulder joint itself, the scapulohumeral joint, or in the structures right around it.
Like the muscles, tendons?
Exactly. Muscles, tendons, ligaments, even the nerves in that area. And it shows up, outwardly as that limp and abnormal gait.
Oh.
Or just the dog not wanting to use that front leg normally.
And why is getting this diagnosis right so important? I mean, beyond just wanting your dog to feel better.
Oh, it's huge. It massively impacts their quality of life. For an active dog, it could stop them doing what they love, running, jumping, competing. For any dog, really, it affects just walking and playing. And here's the really crucial bit. If you don't figure out the underlying cause and figure it out fairly early, it can lead to chronic long-term pain. It can cause compensatory issues. The other legs start hurting because they're taking extra strain. And potentially it can lead to irreversible joint damage, like really severe arthritis down the line. That's the big why for needing an accurate diagnosis.
Okay. And you said it's tricky. What makes diagnosing shoulder problems so difficult?
Well, there are a few things. Firstly, think about it. That joint is covered by some really thick, strong muscles.
Right.
Which makes it hard for a vet to, really feel what's going on deep inside during a physical exam. The joint itself, its biomechanics, how it moves, it's complex. Often, the very first signs an owner notices are incredibly subtle. It's just a little hesitation, maybe a tiny head bob, or even just a change in how they sit down.
Things you might almost miss.
Exactly. And then to make it even tougher, you've got lots of different conditions, completely different problems that can all cause lameness that looks surprisingly similar from the outside.
Wow. Okay.
So that inherent complexity, that's why the whole diagnostic process has to be so thorough, so systematic.
Which means, I guess, before you can figure out what's wrong, you need to understand the parts, right?
Yeah.
The anatomy.
Precisely. A solid grasp of the anatomy is absolutely fundamental. You need to know the players involved to understand what might be going wrong.
Okay, so help us picture it. What are the main bones we're talking about in the dog's shoulder?
Okay, so you've got the scapula, that's the shoulder blade. It has a pretty shallow socket on it called the glenoid cavity.
Shallow, okay.
And then you have the humerus, which is the upper arm bone. It has a rounded head that fits into that shallow glenoid socket. The humerus also has some important bumps, the greater and lesser tubercles, and this specific channel or groove on the front called the bicipital groove, that groove is important.
That shallow socket sounds like it means the joint isn't super stable, just from the bones fitting together.
That's exactly right. Unlike, say, the hip joint, which is a deep ball and socket.
Much more stable.
Right. The shoulder's more like, well, people say a golf ball on a tee. It's very mobile, which is great, but that mobility means it doesn't have much bony stability. It relies heavily on all the surrounding soft tissues, the muscles, tendons, ligaments, the joint capsule to hold it together and control its movement.
Okay, so what are some of those critical soft tissues that often get involved when there's a shoulder problem?
Well, you've got the joint capsule itself. That's the fiber sac around the joint.
Yeah.
It's actually quite loose, which allows for that big range of motion.
It doesn't hold it tight.
Exactly. It doesn't provide much passive stability. Then you have ligaments. like the medial and lateral glenohumeral ligaments. They're basically just thickenings of that capsule, offering a little bit more support. But there's one really important structure called the transverse humeral retinaculum. Think of it like a little seatbelt. It's a band of fibrous tissue that holds the biceps tendon firmly in that bicipital groove on the humerus. Very important.
And the muscles and their tendons must be crucial here too. Are there specific ones that are particularly key or prone to problems?
Oh, absolutely. Several key ones. The supraspinatus and infraspinatus muscles, they sit on the outside of the shoulder blade, and their tendons attach to that greater tubercle bump on the humerus.
Okay.
They help extend and rotate the shoulder, and yeah, their tendons are common spots for injury or degeneration. Then there's the biceps brachii. The sources say its tendon is probably the most commonly affected tendon in the shoulder.
Really? Why is that?
Well, its tendon actually originates inside the joint itself, then runs down through that bicipital groove we mentioned because it crosses the joint and runs in this sort of bony tunnel. It's really susceptible to friction or compression or strain injuries. Then on the inside of the joint, you've got the subscapularis muscle, also important for stability.
The sources also mentioned bursae. And nerves.
Yep. Bursae are just little fluid-filled sacs that reduce friction between moving parts. And the nerves are critical too, specifically the brachial plexus. That's a big bundle of nerves coming from the neck area, C6 down to T2 spinal segments down into the front leg. Damage to these nerves can definitely cause what looks like shoulder lameness.
Right. So knowing where all these bits are, what they do, how they work together, that's the foundation for figuring out the why behind the limp.
Exactly. It's the roadmap.
Speaking of the why, the sources seem to group the potential causes into broad categories. What are those main groups?
Yeah, thinking in categories just helps organize the possibilities. The main ones are developmental things that go wrong during growth, traumatic injuries, degenerative wear and tear type issues, inflammatory including immune system problems, and neoplastic, which means tumors.
Okay, let's take developmental first. Issues from when a dog is growing. What's a really common one there?
Osteochondritis dissecans, or OCD, is probably the one most people have heard of.
Right, OCD.
It typically hits young, rapidly growing large breed dogs, usually between, say, 5 and 10 months old. It's basically a flaw in how the cartilage develops on the end of the bone.
Okay.
A piece of cartilage doesn't mature properly. It can crack, separate, and form this painful flap, usually on the back surface of the humeral head inside the joint.
Which breeds are prone to this?
Oh, the usual suspects for developmental bone issues: Labs, Goldens, German Shepherds, Rottweilers, Great Danes, Newfoundlands, those fast-growing large breeds.
And what about shoulder instability? The sources mention medial shoulder instability, MSI.
Yeah, MSI relates to laxity or looseness in the joint. It's often a more chronic thing. Sometimes it's linked to a bit of congenital looseness combined with repetitive microtrauma from being very active.
Ah, so not one big injury necessarily.
Often not. It's common in really active or athletic dogs, think border collies, hunting breeds. It leads to this subtle instability, maybe even tiny subluxations, where the joint briefly partially dislocates, especially when they're putting weight on the leg. True congenital dislocation when the joint's out from birth, that's rare.
The sources also mention infraspinatus contracture under developmental, but you said it happens in adults.
Yeah, it's a bit of an odd one to categorize. It happens in adult working or hunting breeds, usually due to repetitive microtrauma leading to scarring in the muscle. But the effect, this really characteristic gait change, develops later. We'll definitely come back to that when it's quite distinct.
Okay. Moving on to traumatic causes then. Actual injuries. What's a big one here?
One of the most frequent causes, especially in active adult dogs, is Biceps tenosynovitis, or tendinopathy.
That tendon in the groove again.
Exactly. Inflammation or degeneration of that biceps tendon. Often it's from chronic repetitive strain, things retrieving, jumping, agility.
Yeah.
Or it can happen acutely, maybe with a sort of slip or hyperextension injury. It causes pain and inflammation as that damaged tendon tries to slide through groove. It can even rupture sometimes.
Ouch. What else falls under traumatic?
Well, similar issues can happen with the supraspinatus tendon, that's supraspinatus tendinopathy. Degeneration, sometimes with calcium deposits forming in the tendon, again, often linked to repetitive strain in adult working dogs or retrievers.
Okay.
Then you have your more obvious traumas. Acute traumatic luxation, a sudden full dislocation, often from significant force like being hit by a car. Usually they dislocate medially towards the body. Actual fractures of the scapula or the top of the humerus, those need pretty major trauma.
And there was a nerve injury mentioned too, brachial plexus avulsion.
Yes, that's a really serious one. Nerve damage. Caused by severe trauma car accident, a bad fall, where the nerves of the brachial plexus are stretched violently or actually torn away, avulsed from the spinal cord.
Right.
Yeah, it affects the function of the whole leg, causing major sensory and motor problems. Really challenging injury, any age.
Okay, what about degenerative causes? The wear and tear stuff.
The big player here is osteoarthritis, or DJD, degenerative joint disease.
Arthritis, yeah.
It's that chronic breakdown of the joint cartilage. Leads to pain, stiffness, reduced function. Super common in older dogs, and often it's secondary, meaning it develops because of some other underlying issue like untreated OCD or chronic instability. But it can also just develop with age and normal wear and tear, what we call primary OA. It's a major cause of chronic lameness, especially in seniors. The sources also briefly touch on degenerative myelopathy, which is actually a spinal cord disease.
Not the shoulder itself.
Right. But later in the disease, it can cause forelimb weakness that might look like shoulder lameness. But the root cause is the spinal cord nerves.
Got it. Next category, inflammatory and immune-mediated.
Right. So immune-mediated polyarthritis, IMPA. That's where the dog's own immune system mistakenly attacks multiple joints, causing inflammation without an infection.
Polyarthritis meaning multiple joints.
Exactly. Shoulders are often involved. You might see lameness that shifts from leg to leg, maybe fever, lethargy. Then you can have just non-infectious inflammation like bursitis or tenosynovitis, maybe just from overuse or a minor bump. But critically, there's also infectious arthritis or septic arthritis.
Infection in the joint.
Yes,
Right.
Usually bacterial, maybe from a penetrating wound near the joint or an infection spreading from elsewhere in the body. This is an emergency. It causes acute, really severe lameness, intense pain, swelling, heat in the joint, often fever, needs immediate attention.
Yeah, and the last category, sadly, neoplastic tumors.
Yeah. Unfortunately, tumors can affect the shoulder area too. You can get primary bone tumors like osteosarcoma, that's an aggressive bone cancer, and the proximal humerus, the top of the upper arm bone near the shoulder, is a common site for it. There are other bone tumors like chondrosarcoma too, or you can get soft tissue sarcomas developing in the muscles or connective tissues around the joint. And then there are peripheral nerve sheath tumors, PNSTs, or schwannomas.
Affecting the nerves directly.
Exactly. They arise from the nerve coverings in the brachial plexus. They can be very painful, they tend to infiltrate locally, and they cause progressive lameness and often significant muscle wasting. And finally, you can get metastatic tumors, cancer that started somewhere else, like the lungs, spreading to the shoulder bones or tissues.
Goodness. Neoplastic causes sound like they often cause pretty severe and progressive lameness.
Generally, yes. Often steadily worsening, significant pain, maybe noticeable swelling.
Wow. Okay, that is a huge list of potential reasons for a shoulder limp. So with all those possibilities, what might an owner actually see? What are the typical signs that might make you suspect the shoulder specifically?
Well, obviously you'll see general lameness first. It might be what we call weight-bearing lameness, painful when they put weight down. Or sometimes it's more obvious during the swing phase when the leg is moving forward. That classic head bob is a really common sign of forelimb pain.
How does that work again?
The head goes down when the good leg hits the ground and up when the painful leg hits the ground. It's an effort to shift weight off the sore limb.
Ah, okay. Makes sense.
And often the stride on the affected side will be noticeably shorter. They don't reach as far forward.
Are there clues that point more specifically to the shoulder rather than, say, the elbow or the paw?
Yes, definitely. Some signs are more suggestive of the shoulder, like a real reluctance to put full weight down, maybe just toe touching, or holding the leg up slightly. When they're standing still, you might notice them pointing that affected limb forward a bit.
Pointing.
Yeah, sort of holding it slightly out in front, almost like they're trying to take pressure off the back of the joint or relax the muscles. You might see abnormal movement of the shoulder blade itself as they walk. Reduced reach or overall range of motion is a big one.
And muscle loss.
Muscle atrophy, yes. That's a really significant sign, especially for chronic issues. The muscles over the shoulder blade, the supraspinatus and infraspinatus, can really shrink down noticeably compared to the other side because they're not being used properly or because of nerve issues.
The sources also mention self-mutilation, licking or chewing.
That can happen, yeah. Sometimes due to chronic pain, especially if there's nerve involvement causing weird sensations. And predictably, for active dogs, A decrease in performance, not wanting to jump, run as fast, retrieve as long. That's often one of the very first things an owner notices.
And then during the vet exam, pain on certain movements.
Exactly. Finding pain when the vet carefully palpates specific spots around the joint or gently moves the shoulder through its normal range of motion, flexion, extension, abduction, adduction. That's a key indicator pointing towards the shoulder.
Okay, so you see some of these signs, you're worried, you head to the vet suspects the shoulder, but like you said, so many possibilities. How does the vet even begin to narrow it down? What's in their diagnostic toolkit?
It absolutely requires a systematic approach, like being a medical detective, really. Start broad, then zero in.
And the orthopedic exam is the critical first step,
Right.
right? What are vets actually looking for and doing there?
Yeah, the hands-on exam is fundamental. First, just observation. Watching the dog move, walk, trot, maybe up and down stairs if possible, or getting up from sitting. Those movements can highlight subtle issues. Looking for that head bob, any asymmetry, how they hold themselves, how the feet land. Then comes palpation, carefully feeling the structures. The vet will gently feel the bones around the shoulder, the joint itself, the major muscles. They're checking for any pain response, swelling, heat, that muscle wasting we talked about, or crepitus, that crunchy, grinding, or popping feeling that can suggest cartilage damage or arthritis.
Right.
Then they assess the range of motion, or ROM, gently moving the joint through its full arc, flexion, extension, abduction, moving it away from the body, adduction, moving it across the body, noting if there's pain at any point, if the motion is restricted, or if maybe it's excessively loose compared to the other shoulder.
And the sources mention some specific shoulder tests that are really helpful, but often need sedation. Why sedation?
Yeah, because those shoulder muscles are so strong, and dogs are often tense or guarding a painful area. Light sedation just helps them relax, allowing the vet to manipulate the joint more thoroughly and accurately without the dog resisting due to pain or anxiety. It makes the specific tests much more reliable.
What kind of specific tests?
Well, for example, there's specific palpation right over the biceps tendon in its groove, applying direct pressure there, or doing a maneuver like extending the shoulder while flexing the elbow that stretches the biceps tendon. If that causes pain, it's a strong pointer towards bicipital tenosynovitis.
Ah, okay.
There are also specific tests designed to assess shoulder instability, trying to feel for excessive drawer motion or laxity side to side, and that really characteristic test for infraspinatus contracture, checking if the limb cannot be internally rotated normally. These specific maneuvers really help zero in on the likely structures involved within the shoulder complex.
Okay, so the physical exam points strongly to the shoulder. Imaging is usually next, but you mentioned different types show different things.
Exactly. Each imaging tool has its own strengths and weaknesses. The vet chooses based on what they suspect after the exam.
Radiography x-rays are usually first up. What are they good for?
X-rays are excellent for looking at bone. They're great for spotting fractures, those OCD cartilage flaps, bone tumors, or signs of advanced chronic arthritis like bone spurs or a narrowed joint space. You usually need multiple specific views to see the shoulder properly, and sometimes comparing views of both shoulders helps.
But the limitation.
The big limitation is soft tissue. X-rays are just not good for visualizing things like tendons, ligaments, the joint capsule, cartilage surfaces, or nerves. They basically pass right through them.
So for those soft tissues, you might need something like ultrasound.
Yes, ultrasound is really valuable for assessing soft tissues near the surface. A skilled operator can get good images of the tendons, biceps, supraspinatus, infraspinatus. They can look for thickening, tears, inflammation, calcification. They can see the joint capsule, detect excess fluid in the joint. It's also dynamic. You can watch the tendon move.
What are the downsides of ultrasound?
Well, it's very operator dependent. You need someone experienced to get and interpret the images correctly. And it can't see through bone, so it can't visualize structures hidden deep within the joint or the cartilage surface itself very well.
What about CT scans? Computed tomography. Sounds more detailed for bone.
It is. CT uses X-rays from multiple angles to create detailed cross-sectional images. It's fantastic for bone detail, subtle fractures, complex joint shapes, bony tumors. It's being used more and more for shoulders.
Can't it see soft tissue at all?
Less well than MRI for pure soft tissue detail, but it's better than X-rays. Sometimes contrast dye is used, which can help highlight inflammation or soft tissue masses. The main downsides are radiation exposure and still not being the best for tendons and ligaments.
And MRI magnetic resonance imaging, that's often called the gold standard, especially for soft tissues.
Yeah, the sources definitely point to MRI as the gold standard for visualizing soft tissues. It uses magnetic fields, not X-rays, to create incredibly detailed images of tendons, ligaments, the joint capsule, cartilage, the synovial lining of the joint, muscles, and crucially nerves.
So it's ideal for things like tendon tears, inflammation, nerve issues.
Exactly. Inflammation, subtle tears, impingement problems, and especially things like brachial plexus tumors or nerve root avulsions. It gives the clearest picture of those structures. The limitations are cost, availability, and the need for general anesthesia because the dog has to be perfectly still for quite a while.
And then there's arthroscopy, actually looking inside.
Right. Arthroscopy is minimally invasive surgery. A tiny camera on a scope is inserted directly into the joint through small incisions. This allows the surgeon to directly visualize the structures inside the joint, the cartilage surfaces, the origin of the biceps tendon, the ligaments, the joint lining.
So you can confirm things right there.
Absolutely. It's invaluable for confirming diagnoses like OCD, visually assessing instability, seeing the state of the biceps tendon, finding loose bodies in the joint. And the big advantage is you can often treat the problem at the same time, remove that OCD flap, release the biceps tendon, clean up damaged tissue.
What are the downsides? Still surgery, right?
It is still surgery, requires anesthesia, specialized equipment, and surgical expertise, but it's minimally invasive compared to opening the joint fully.
Are there any other diagnostic tools vets might use?
Yes, depending on suspicions. If infection or an immune condition like MPA is suspected, they might do a joint fluid analysis arthrocentesis.
Taking fluid out.
Yep, taking a sample of the synovial fluid from the joint with a needle. They analyze the cells in the fluid, check for bacteria, maybe culture it. If a nerve problem like brachial plexus injury or a nerve tumor is high on the list, specialized tests like EMG electromyography and nerve conduction velocity studies can assess nerve function and pinpoint damage. For suspected tumors, a biopsy is often needed to get a definitive tissue diagnosis. And sometimes, vets use a therapeutic block, injecting local anesthetic into the joint or around specific nerves. If the dog's lameness significantly improves temporarily.
It confirms that area is the source of pain.
Exactly. It helps confirm the shoulder region is the problem before moving to more invasive or expensive tests or treatments.
That is a really comprehensive diagnostic process. And it sounds like, based on the sources, once you get through all that, tendon and ligament issues are super common culprits in adult dogs.
They really are. The sources suggest that if you exclude the developmental stuff like OCD, these tendon and ligament conditions make up the bulk of shoulder lameness causes diagnosed in adult dogs.
Okay, let's dive a bit deeper into a few of those really common ones, pulling out the key details. We mentioned bicipital tenosynovitis tendinopathy a few times. What's the core issue there? What's the typical story?
Right. The core problem is injury and subsequent degeneration of that biceps tendon, specifically where it runs in the bicipital groove on the humerus. It's often a chronic strain injury, think wear and tear from activity.
Like fraying a rope.
Exactly like fraying a rope. Over time, you get inflammation, then degenerative changes set in scar tissue, adhesions that make the tendon stick as it moves, maybe even calcification, those calcium deposits, forming within the tendon or bony reactions around the groove itself.
And the typical story, how does it usually present?
Usually it's lameness that comes on gradually, insidiously, often over weeks or months. It might be subtle at first, maybe intermittent, but typically worsens with exercise, especially those repetitive activities or heavy front leg use, though sometimes you can have an acute flare-up after a specific incident.
Which dogs tend to get it?
Typically medium to large breed dogs, usually skeletally mature, so over a year old, often in their prime athletic years, say 3 to 7 years old. Commonly.
And what are the key physical exam signs for biceps issues?
Well, the lameness pattern itself often involves a shortened swing phase. They don't reach forward as much, trying to avoid fully extending that shoulder. On the exam itself, pain can be inconsistent, but the most reliable sign is usually eliciting pain with deep, direct pressure over that bicipital groove.
Okay.
And especially combining that pressure with specific movements, like flexing the shoulder while extending the elbow that puts maximal stretch and stress on the biceps tendon. And if it hurts, that's a strong indicator.
Radiographs might be normal early on, but show changes later.
Correct. In acute or early cases, x-rays often look completely normal. But in chronic cases, you might start seeing signs of that bony reaction on the supralinoid tubercle, where the tendon originates. Maybe visible calcification in the tendon, or sclerosis, increased bone density, and bony spurs developing in the floor of the groove itself, signs of chronic irritation.
An ultrasound or MRI would confirm it.
Yes. Ultrasound and MRI are excellent for actually visualizing the tendon changes thickening, fiber disruption, fluid, calcification. Arthroscopy can also directly visualize the intra-articular part of the tendon and rule out other joint problems.
So how is bicipital tenosynovitis typically treated?
Treatment usually starts with medical management, and the cornerstone of that is strict rest and activity restriction. Absolutely crucial. You have to stop the repetitive strain.
Makes sense.
Then controlling pain and inflammation, usually with canine-specific NSAIDs, those non-steroidal anti-inflammatory drugs like carprofen or meloxicam. A very common next step, sometimes even the first step, is an injection of a corticosteroid medication directly into the joint space or around the tendon sheath.
Like a targeted anti-inflammatory shot.
Exactly. The source specifically mentions prednisolone acetate as a common choice. It delivers the anti-inflammatory right to the source of the problem.
But the sources mentioned medical management isn't always a permanent fix.
That's right. The success rate for a good long-term outcome with medical management alone is estimated around 50 to 75%, maybe better for milder, earlier cases. But if the lameness keeps coming back, or if there are significant chronic changes already visible on imaging, or if medical management just flat out fails, then surgery is often the next recommendation.
What do the surgeries for biceps problems involve?
The two main surgical options are called tenodesis, or release. Tenodesis involves surgically cutting the biceps tendon near its origin inside the joint and then reattaching it securely to the humerus bone a bit further down, outside the groove.
So it doesn't slide in the groove anymore.
Precisely. It eliminates the movement through that painful, damaged area. The other option is a biceps tendon release, which simply involves cutting the tendon near its origin and just letting it retract.
Just cut it. Does the muscle still work?
It sounds drastic, but yes. The muscle belly then forms scar tissue attachments lower down, and functionally, dogs do very well. The primary goal is eliminating that painful friction and movement within the groove. Both procedures can often be done minimally invasively with arthroscopy or through a more traditional open surgical approach.
And what's the prognosis after treatment?
With successful medical management, it's considered fair to good, but recurrence is a concern. With surgery, the prognosis is generally better good to excellent outcomes are reported in around 90% of cases, meaning significant improvement in limb function. Recovery takes time, though, anywhere from 2 to 8 months of rehab. Both release and tenodesis seem to achieve similarly high rates of functional improvement.
Okay. Another specific condition you mentioned was mineralization of the supraspinatus tendon. What's going on there?
This is somewhat similar, involving degeneration and inflammation, but this time in the supraspinatus tendon, usually right where it inserts onto the greater tubercle of the humerus. The exact cause isn't fully known, but again, repetitive strain is thought to play a big role. The key feature is these granular calcium deposits forming within the substance of the tendon.
And what does that look like clinically? How does the dog present?
The history can be very similar to biceps issues, that gradual onset chronic lameness, often worse with activity. But interestingly, the sources note that physical manipulation of the shoulder often does not produce a consistent pain response with this condition, unlike with the biceps tendon typically. You might, however, be able to feel a firm swelling over that greater tubercle area.
And I assume x-rays are key here to actually see the calcium.
Yes, radiographs are very important. You'll see these distinct calcified spots or foci near the greater tubercle. There's a specific x-ray view called a skyline view that can help differentiate supraspinatus mineralization from calcification in the biceps tendon, which is nearby. And an interesting point the sources make is that it's often seen bilaterally on x-rays present in both shoulders, even though the dog is usually only lame on one side.
So if it's often in both shoulders, but only one is lame, does that mean it can sometimes just be an incidental finding, not actually the cause of the lameness?
Exactly. That's a crucial point. You have to be sure that the mineralization is really the source of the pain and not just something seen on the x-ray, while the actual problem is, say, mild arthritis or something else entirely.
Right, due diligence.
Absolutely. But if it is determined to be the cause, and medical treatment like rest and NSAIDs doesn't resolve the lameness, then surgery is usually required. The surgery involves removing those calcium deposits and debriding or cleaning up the affected tendon area.
And prognosis after that surgery?
Generally reported as good to excellent. Most dogs do well, although recurrence of the mineralization is possible, but apparently uncommon.
And related to that was avulsion or fracture of the supraspinatus tendon.
Yes, this is where a strain injury is so forceful that it actually pulls a small piece of bone off the greater tubercle right where the supraspinatus tendon attaches. The clinical signs are very similar to mineralization.
How does it look different on x-ray?
On X-ray, instead of just seeing dense calcium spots within the tendon's path, you see an actual small fragment of bone pulled away from the main body of the greater tubercle. It looks like a little chip or defect in the bone surface, and the fragment itself is generally less dense, less bright white than typical mineralization foci.
Because there's a bone fragment involved, does this usually need surgery?
Often, yes. That loose piece of bone can act as a persistent irritant to the tendon and the surrounding tissues. Surgery typically involves removing the fragment or sometimes attempting to reattach it if it's a large enough piece, though removal is common.
Prognosis similar to mineralization removal.
Yes, generally good to excellent function is expected after successful surgery. Again, recurrence is possible but not common.
Okay, finally, let's revisit that really interesting one. Infraspinatus contracture. You said it has a unique presentation.
It really does. It's a fascinating condition. It's a primary problem of the infraspinatus muscle and its tendon. Fibrous scar tissue progressively replaces the normal muscle fibers.
So the muscle loses its stretch.
Exactly. It loses its elasticity, it can't lengthen properly, and it usually atrophies, shrinks as well.
Yeah.
It's thought to be caused by some initial injury, perhaps repetitive strain or microtrauma, particularly in active adult hunting or working breeds.
And the history is quite specific too, you mentioned.
Yes, the sources describe a typical history. Often, the owner recalls an episode of acute lameness, maybe during or after exercise. That initial pain and lameness might actually seem to resolve over a couple of weeks.
So they think the dog is better.
Potentially, yes. But then, maybe 3 to 4 weeks later, a different chronic, persistent lameness develops. And interestingly, at this chronic stage, the shoulder often isn't particularly painful to manipulate.
So what are those distinctive signs the vet looks for in the chronic stage?
This is where the diagnosis often becomes pretty clear just from the physical exam. The key finding is that you absolutely cannot internally rotate the affected shoulder joint. You can't turn the paw inwards towards the body in a normal way. When you try, the whole shoulder blade lifts off the chest wall.
Wow.
When the dog is standing, you'll often see the elbow on that side held close into the chest adducted, while the lower leg and paw are rotated outwards abducted. And the gait is the real giveaway. When they walk, instead of swinging the lower limb straight forward, it swings out in a distinct lateral arc away from the body. That's called a circumduction gait. It's very characteristic. Plus, you usually see really marked muscle atrophy, significant wasting of that infraspinatus muscle over the shoulder blade.
And x-rays are normal for this condition?
Yes, typically radiographs of the shoulder are completely normal in cases of infraspinatus contracture. The diagnosis is often made primarily based on that unique combination of history and those very specific physical exam findings. Ultrasound or MRI could show the changes in the muscle texture, but they often aren't needed if the clinical signs are classic.
How is infraspinatus contracture treated? Can medical management help?
No, medical management rest drugs is completely ineffective once the contracture, the fibrous scarring, is established. It doesn't reverse that fibrosis. This condition requires surgery for resolution.
What does the surgery involve?
The surgery involves surgically cutting, transecting the tight fibrotic infraspinatus tendon, or sometimes a portion of the scarred muscle belly itself. The source mentions that during the surgery, the surgeon often feels a distinct pop as the restriction is released, and normal range of motion is immediately restored on the table.
And rehab afterwards?
Yes, post-operative physical rehabilitation is considered crucial to help the dog regain strength and normal limb use patterns.
What's the prognosis after surgery for this one?
It's reported as very good to excellent for functional recovery. Most dogs are expected to return to normal limb function and their previous activity levels. However, one interesting point the sources make is that while the function returns, that characteristic limb carriage, the elbow slightly adducted, paw slightly abducted when standing, might not completely normalize visually in all cases, even though the dog is no longer functionally impaired by it.
That's a fantastic deep dive into some of the really common specific problems. So, okay, pulling it all together now. Given this huge variety of issues we've discussed, how do vets approach treatment overall, and what are the general prognoses like?
Well, the absolute key is that treatment is entirely dictated by the specific diagnosis reached after that systematic workup. There's almost never a single shoulder lameness treatment.
Right. It depends entirely on whether it's OCD or biceps tendinitis or arthritis or a tumor.
Precisely. It depends on the exact condition, how severe it is, the dog's age, breed, activity level, the owner's goals and resources. Often, the best approach involves a combination of medical management, maybe surgery, and definitely rehabilitation.
Medical management is often the first step or used alongside surgery. What does that typically involve?
Rest and strict activity modification are almost always paramount, especially early on or after injury. You have to allow tissues to heal. Pain and inflammation control is key, typically using those canine-specific NSAIDs. We mentioned things like creprofen, meloxicam, firecoxib. They're usually the first line.
Yeah.
For systemic inflammatory conditions like MPA, systemic corticosteroids might be needed. For focal inflammation, like in the joint or tendon sheath, those targeted intra-articular injections can be used judiciously. Joint health supplements, or DEMO, it's disease-modifying osteoarthritis drugs like injectable PS-JAGs, might be recommended to try and support joint health or slow cartilage degeneration, though the evidence for oral supplements like glucosamine is still debated.
Weight management too, I imagine.
Absolutely critical, especially for chronic conditions like arthritis or instability. Reducing load on the joint makes a huge difference. And as we've touched on, physical rehabilitation physiotherapy is really an essential component now, not just an add-on.
What are the goals of rehab?
The goals are to reduce pain and inflammation, restore or improve range of motion, strengthen the supporting muscles around the shoulder, and help the dog return to normal functions safely. It uses techniques like specific exercises, stretching, maybe hydrotherapy, laser therapy. For specific things like septic arthritis, of course, the core medical treatment is aggressive antibiotics and often flushing the joint.
And surgical management covers a whole spectrum of procedures.
Exactly. We've talked about many of them already. Arthroscopic removal of OCD flaps, biceps tenodesis or release, surgical stabilization for shoulder instability, which might involve tightening the capsule or using artificial ligaments, reducing and stabilizing traumatic dislocations, sometimes followed by a Velpo sling to immobilize the shoulder, that surgical transection for infraspinatus contracture, removing calcium deposits or bone fragments from the supraspinatus tendon, managing tumors, which could range from limb amputation for something like osteosarcoma to limb-sparing surgeries in specific cases, and of course, surgically repairing fractures.
And the prognosis, you've given specifics, but overall it really varies.
It varies hugely, yes. Just to recap some key ones. For OCD, if caught and treated early with surgery before major arthritis sets in, the prognosis is generally good to excellent. For biceps tendinopathy, medical management success is variable, maybe 50–75% with recurrence possible. Surgical tenodesis or release offers a better long-term prognosis, typically fair to good functional outcome. Shoulder instability prognosis is variable, can be good to excellent with surgery for milder cases, but can be frustrating and may have residual issues in more severe or chronic ones.
Right.
Traumatic luxations, good prognosis if reduced quickly non-surgically, more guarded if chronic or needing complex surgery. Infraspinatus contracture, good to excellent functional recovery after surgery, even if the stance isn't perfect. Supraspinatus tendinopathy, prognosis is variable, often good with surgery if it's the true cause of pain.
What about the more chronic or serious conditions,
Yeah.
like arthritis or tumors?
For established osteoarthritis, DJD, the prognosis is guarded for a cure because you can't reverse the cartilage damage. Management focuses on controlling pain, maintaining function, slowing progression. It's about long-term management, not cure. For aggressive bone cancers like osteosarcoma, sadly, the prognosis remains poor, even with amputation and chemotherapy extending survival time. Peripheral nerve sheath tumors also carry a guarded to poor prognosis for full limb function due to their infiltrative nature and the nerve damage often required for removal. Recurrence and chronic pain or self-mutilation can be significant issues. And infectious arthritis, if not treated very early and aggressively, is guarded as it can cause rapid, irreversible joint destruction.
This has been a really illuminating deep dive. It just shows how complex that shoulder joint is and how many different things can go wrong.
It really does. It underscores how a seemingly simple sign, a limp, can stem from such a diverse range of causes. Everything from developmental glitches in puppies to tendon wear and tear in athletes to chronic degeneration in seniors, infections, or even life-threatening tumors.
We've journeyed from the intricate anatomy and the many whys of lameness through that whole systematic diagnostic process, the physical exam clues, the specific tests, the power of advanced imaging like ultrasound, CT, MRI, and even looking inside with arthroscopy.
And we've seen that treatment isn't a single recipe, but has to be carefully tailored, often combining rest, targeted medications, specialized physical rehab, and sometimes very specific, complex surgical procedures, all aimed at the underlying cause and the individual dog.
It's definitely clear that while the outcome varies so much depending on the specific diagnosis, getting that diagnosis accurately and as early as possible, and then starting the right treatment aggressively, well, that's absolutely crucial for giving these dogs the best chance at a good recovery and preserving their quality of life.
Yeah, it really highlights the importance of owners noticing those early, sometimes subtle signs and seeking veterinary advice sooner rather than later. Don't just wait and see if it gets better on its own, especially with shoulder issues.
So thinking about everything we've covered, the complexity of the diagnostic challenges, the range of conditions from subtle instabilities to aggressive nerve tumors, and the fact that even with advanced treatment, some conditions remain frustrating and cause long-term issues. What does this really tell us about the ongoing frontiers in veterinary orthopedics and pain management? And maybe more importantly, what does it tell us about the critical role that your careful observation of your own dog plays in kicking off this entire process?
That's a great question. I think it tells us that while veterinary medicine is constantly advancing, developing better imaging, refining minimally invasive surgical techniques, finding new ways to manage pain, the absolute foundation, the very first step in addressing any of these complex shoulder issues still relies fundamentally on the owner's vigilance. Your observation, noticing that subtle change in gait, that reluctance to jump, that slight muscle loss, that's the spark. That's what initiates the whole diagnostic journey and allows us to apply all these advanced tools and treatments effectively. Your role as your dog's primary observer is, well, it's irreplaceable.
A really profound thought to end on. That connection and observation is where it all begins. Thank you so much for joining us on this deep dive today.
My pleasure.